Hello, we are Group 5b, and this is our presentation about a comprehensive plan for radical belonging. So to start us off, we have a couple of definitions of radical belonging that we looked into to influence our own definition, which will be forthcoming. So the first of these is radical belonging is when we allow people in our lives all of their glorious uniqueness, where we don't have these ideas that they need to be a certain way in order to meet up with our approval, where we can recognize that humans are also quite fragile in the world. This was by an author who wrote a book about belongingness in the workplace, Lindo Bacon. And his book is becoming quite popular as a source for new workplace leaders to help create more diverse and inclusive workplaces. Another definition that we found was radical kindness sits at the heart of cohesion and integration work as it involves proactively reaching out across differences, tackling prejudices, separation and segregation, and building bonds with people from different ethnic, socioeconomic, faith, and age groups. This came from a study about radical belonging, and this is the definition that they used when they were doing their research. And finally, another study defined belonging as much as a quilt is more than a collection of individual threads, radical belonging is more of a collection of individual experiences. It exists in the interweaving of the diverse knowledges, strengths, goals, and needs that different members of the community bring. And as our emphasis on agency and mutuality in all aspects of radical belonging indicates, radical belonging cannot be done to anyone. This means that continually working not just to include those who are easiest to include, but those who are hardest. Across all of these different definitions, we can see a very strong connection between including every person, regardless of background, and going beyond inclusion to really integrate them into the framework of the workplace.
Our definition. So what we learned is that radical belonging includes everyone, regardless of race, socioeconomic background, religion, sex, gender identity, age, or health status. Radical belonging is an active and ongoing process, and radical belonging requires acknowledgement and celebration of differences in life experience to create a more equitable society and organization. So our definition is radical belonging actively celebrates the uniqueness of each individual and the opportunity for each individual to bring something different to the table.
There are a couple of different studies that we found that demonstrated the importance of including radical belonging in healthcare systems. The first of these found that decreased personal and team belonging had negative impacts on employee morale and retention in the hospital during COVID-19. A second found that community belonging was more likely to result in improved perceived general and mental health status. Those who had a decreased sense of community belonging were less likely to report good perceived general health and mental health. And increased feelings of belonging resulted in less fatigue and less emotional exhaustion, as well as improved safety behaviors, which we know is very important in our healthcare work day to day. And finally, occupation-based mental health programs that addressed belonging helped improve mental health and well-being outcomes and encouraged employees to use resources that were provided both by the workplace and the entire community.
So we had several ideas for how we can support radical belonging in the healthcare system. We separated them based on an organizational, a team, or an individual basis. On an organizational level, we concluded that having a shadow day where professions were shadowing each other would be great for helping improve radical belonging in our healthcare system, since a lot of professions don't seem to understand what the other profession does, and having them shadow would be great for them to learn about what every other specialty in the healthcare field does. Importantly, all of these activities should potentially be paid. We felt that having employees take time out of their schedule unpaid to do these activities were not beneficial to radical belonging. On the team level, we believe that corporate retreats where healthcare teams collaborate in a friendly competition would build team bonding as well as cooperation among team members, and that would help with radical belonging. Another thing we had for the team level is having some paid training for how to incorporate team members of other socioeconomic backgrounds. Sometimes the gap in supporting radical belonging among team members is that team members simply do not know enough about each other and their backgrounds. And we felt that having training for them to be able to include others would be beneficial to support radical belonging. On the individual level, we believe that individual perks provided by a healthcare system would be helpful to improve radical belonging. Given that most people, when they go to work in the healthcare system, they feel that they are just doing work. If they were offered perks, they would feel like they actually belong to a family or a community of like-minded individuals in the healthcare field. And we had just some ideas about these perks, such as reimbursements for like commute, food, childcare, healthcare, regional events, things like that. And it's important that these activities on different levels would support radical belonging.
Addressing inequity. COVID-19 largely impacted those who had little to no health insurance and those who did not have education regarding the disease. So we came up with a few ways to ensure equity within marginalized communities. So we recommend implementation of focus groups for dialogue, multiple professions shadowed to include varying levels of workplace hierarchy, and an outreach program to allow adequate education to marginalized communities in their own environments rather than expecting people in these communities to seek out help and education.
Yeah, so there are a few implementation steps that we will need to do in order to get our idea off of the ground. First off is that we want to work with the management and leaders of each profession. This will help with the logistical aspect because they will help guide the groups, like who can be the mentors and what times people can do the shadowing. This will help cut down on like any impacts to productivity. And also it'll give the managers a chance to set the agenda and guidelines of what issues they want to address. But more importantly, we also want to work with employees of each profession. We want to hear from them and encourage them to speak amongst themselves and their peers and other colleagues from different professions about the unique challenges they face. And we believe that by them sharing their challenges, they'll get a better understanding for each profession, and that will help them get a better sense of belonging and will cut down on any miscommunication or unintentional frustration. And lastly, we want to work most importantly with the underrepresented. This is very important because as the underrepresented, they hardly have a voice. And so we want to set time aside for them so that they can speak up and address what specific challenges they face and what things that need to be done to help them succeed in the profession. It will not only this help like improve productivity, but also help them get a sense of belonging, that they actually believe that they actually belong here, and that we are taking steps to ensure that they can come to work and they can thrive and be successful.
So for our map to success, we have short-term goals and we have long-term goals. With our short-term goals, it's really important to figure out what the issues are specifically, because we can implement changes, but if it's not what the people in our organization really need and when they really want, then we won't see the outcomes we are desiring for radical belonging. So we need to identify key areas where healthcare workers feel the most negatively impacted. And then we need to identify the greatest needs of the workers, whether this be mental health resources, childcare, what expenses they need covered, what resources they need higher ups to provide for them. And also identifying the best way to support those marginalized groups and their families. And as we mentioned, we're going to be doing this through focus groups, through outreach, meeting with the people who need our help the most and who need the support the most. Then we can move on to long-term goals where we're actually seeing changes implemented and kind of seeing the outcome of all of the changes we want to implement. So we want to see increased employee retention, decreased turnover. People are wanting to keep working here and stay in healthcare and continue what they started at this company. We want to see decreased burnout. We know this is affecting healthcare workers greatly, and they need support and to just feel like they enjoy their work. We want to see an increased sense of radical belonging within the organization. So between different professions, more understanding, like we talked about, celebrating uniqueness in each of our careers and each of our places here.
So in order to determine if we're meeting these goals, of course, we have to have some sort of metrics, some sort of way to see if our program is successful. So one thing that we can do is increase reporting from employees and kind of getting a subjective measure of how they feel that the belongingness is and if they feel happy in their workplace. And then going along with that, increase in employee retention rate would also indicate that the program is successful. And then decrease in variability of pay between staff members of comparable job demands. So just kind of gauging like what the communication is like among staff members and if everyone is being treated equally. And then a decrease in subjective reports of burnout. So again, just kind of overall like opening up that line of dialogue and just making sure that everyone is heard and feels like their job is helping them to feel like they belong. And then kind of on another note, there's also patient metrics. So increase in overall hospital ratings. I think when like employees are happy and they're working well together, that definitely shows in the quality of healthcare that's provided. And then decrease in patient complaints filed. So are patients noticing anything that would be going against the goals of the organization? An increase in patient reports of belonging in healthcare processes and decision-making. So kind of taking it one step further and seeing if patients even feel included in this process and if they feel like just an environment of radical belonging. And then a reduction in patient costs for under or uninsured populations and increased healthcare utilization by patients in underserved populations. So again, just like really trying to see if the healthcare organization is promoting radical belonging and really living out that mission, just making sure that that's being monitored and make sure that if the goals aren't being met, that changes can be made in order to meet those goals. And then how can these ideas be sustained and then spread to other healthcare organizations? So there was an interesting article by the Stanford Social Innovation Review that talked about how mission-driven changes build social capital and therefore spread more easily. So when people feel passionate about ideas, when there's ideas that have a lot of meaning behind them that really like hit close to home, they're much easier to get other people on board and to therefore spread. And then having clear objectives and a stepwise plan for promoting change that can be shared publicly is important. Having kind of a roadmap for how others can achieve the goals that you have achieved is crucial in order to share those ideas and promote those ideas. And then not just having the ideas and then having the ideas in a way that can be shared, but then also having a way to share those ideas. And I think we've all seen how social media can be used as a tool to spread ideas, especially to promote radical belonging. I think it provides an amazing platform to kind of share ideas and also like set an example. I think when you see other people and other examples of things that would be good in your own workplace or things that you want for your own life or for your own organization, that can be really empowering because you can see like they did it and now they've laid out a pathway for me and my organization to do it too. And then I think when you have something like that that's publicized and people are talking about it again, like having an open dialogue, it kind of sets a new standard for the industry and allows innovation. I think like when other people see examples of what they want, then it kind of becomes the new standard and it's what's expected. So I think, yeah, just having a mission and then having a way to achieve that mission and then again spreading that mission is so important. And I think if there's a good idea and the goals are being met, then it's something that other people will want to achieve as well.
Okay, so what we learned about teamwork. So we've decided that effective teamwork looks like when people are respectful of others and their opinions, when we're encouraging everyone's participation and open communication, when we're evenly dividing up tasks based on skill and interest, and making sure that every member of the team feels valued, has purpose, and ultimately belongs. And so if we go back to our definition of radical belonging, which was where we actively celebrate the uniqueness of each individual and the opportunities for each individual to bring something different to the table, when we applied that to putting together this presentation, we had meetings during which we discussed the case, everyone's individual interest in certain topics or sections of the presentation, and we divided up our tasks according to that. We made sure that everyone's voices were heard and each individual had something to contribute to the project. And we took advantage of our unique backgrounds and strengths that we could ultimately create a finished product that reflects our success as a team and what we all feel collectively is effective teamwork, and so that we can all feel like we belonged and contributed something to this presentation. And then this is our works cited. Thank you for listening.